Welcome to tonight's edition of Resistance TV. This evening we're going to be speaking about the latest COVID lockdown with Dr. Bob Gill, and we're going to get his thoughts about the preparedness of the National Health Service and some of the other implications in relation to things like the PPE contracts, the test and trace system, and then hopefully we'll have time to talk a little bit about the ongoing attacks on the National Health Service and the genesis of those. And people viewing this evening may know that Bob produced an excellent film about the way in which the National Health Service is being undermined, called The Great NHS Heist. And if you haven't seen it, I would highly recommend that you download it. I think it's available on YouTube, and Bob can give us the details about that in a moment when we go to him. But I wonder, Bob, perhaps if we could just maybe start by kind of giving us your thoughts on the overview, really giving us an overview of the National Health Service in terms of how geared up it was and why it wasn't geared up adequately to actually deal with the pandemic when it actually hit, particularly given as I understand it, they did a dry run of a potential pandemic a few years ago, and there were various recommendations, as I understand it, that were made which weren't acted upon. What's your thoughts, Bob?
Hi, Chris. Thank you for inviting me on. I think it's important for people to understand how the NHS was before COVID struck, and your question needs to be addressed. In the decade leading up to the end of 2019, we'd seen a defunding of the NHS. So the historical investment in the NHS in that decade was around 1% increase, but natural inflation for the NHS since 1948 averaged around 4%. So what you had was a decade of a 3% cut every year in real terms. So you had the defunding. On top of that, since the financial crash, the NHS lost about 38,000 beds across the NHS, resulting in the UK having the lowest beds per head of population in the whole of Western Europe. So we were very deprived of beds, very low capacity, but we entered into the pandemic with another problem, which was a staffing crisis. So 100,000 vacancies within the NHS, of which 40,000 were nurses and 10,000 were doctors. So you had an NHS on its knees before COVID. And you mentioned exercise sickness. Well, this was a pandemic preparedness exercise carried out in 2016. And although the full document hasn't been made public and is subject to a potential court case to get this made public, it appears that the obvious things were not done, and that was to stockpile PPE, to make sure there was sufficient capacity in intensive care, having enough qualified staff, and ventilators to put people on life support should they need it. A lot of those recommendations, which are blatantly obvious, were not carried out. So the government made an active decision not to prepare. And the result was, when the pandemic struck, there was a massive shortage of PPE, there was a logistical chaos, and we found out that the supply chain had been privatized. The company looking after the stockpile had changed hands several times. But the key thing that also happened in that decade was a major piece of legislation, the Health and Social Care Act 2012, which effectively abolished the existing world-renowned, very robust public health infrastructure. So it shut down public health labs. It sacked, I think it was 10,000 staff who were running Britain's public health. It dismantled the local organization of public health, and it downgraded the leadership. So you no longer had to be a specialist in public health to be a director of public health. So this was a disaster waiting to happen.
And yet the ministers constantly claim that there is record investment going into the National Health Service and that they are absolutely committed to the NHS. And I often see the Secretary of State and the one before him, whenever they appear on TV, sporting a button badge with NHS on it, as sort of, illustrate how much they love and support the NHS. And of course, we have the Prime Minister out on the steps of 10 Downing Street applauding the NHS and healthcare workers. How do you account for what you're saying versus their claims that they are absolutely committed to the NHS and are putting more resources in than the NHS has ever seen?
Well, it costs money to prepare the NHS for privatisation. You have to not only find out what is the total expenditure, but where is that money going? A significant proportion is going to service toxic private finance initiative debt, which has been used as a financial millstone around the neck of the NHS to justify land sales, and the extortionate cost of running a market within the NHS. So if we know that historically the NHS, before it was started to be privatized several decades ago, it had the lowest overhead, the lowest running cost, around 4 to 5%. Now, at best estimates are in excess of 20%. So we have armies of managers and administrators who never see a patient. You could easily do without them overnight, except they are running this internal and now an overt external market. They're also being used to control the staff, to make sure the staff don't step out of line, and to enforce top-down directives, which often mean restructuring services to offer poorer quality care, less safe care, and to organize a subtle change over of the staffing. So we're employing less and less qualified staff on worse and worse terms and conditions, taking greater risk with patient care.
I mean, when I was an MP, as you may know, Bob, I sponsored a bill alongside Jeremy Corbyn and a few others that did so, the NHS reinstatement bill. Obviously, it never got anywhere. And I just wonder, what do you think needs to be done to kind of raise this up the political agenda? I mean, are the opposition parties from the SNP, the Labour Party, and the various other political parties that are represented in the House, I mean, are they, do you think, stepping up to the plate sufficiently to, highlight the threat to the NHS, really, and the way in which, in my opinion, and I think what you're confirming, is this government has let us down in regarding the way in which it's responded to the COVID-19 crisis? I mean, what should we be doing? What could viewers be doing to press opposition MPs to sort of be doing more? Or do you think they're doing enough?
They're not doing enough. This has been, unfortunately, a cross-party joint enterprise. The 13 years of the Blair-Brown administration saw the cementing in of the internal market. Of course, they unleashed private finance initiative. They also enabled legislation to facilitate the NHS land grab. So they've got skin in the game. It was only until the election of Jeremy Corbyn that you started to even hear the word privatization. And I think that was one of the main reasons that there was this internal bureaucratic sabotage of his policies, his chances of election victory, and also the smearing of his character. So I think part of that was down to his more socialist policies, which may have seen the protection of the NHS. But now you have Keir Starmer, who one of his advisors used to work for the private health industry lobby. So he's a lobbyist for privatization. John Ashworth, who we actually interviewed for the film, but he was so weak in his answers, we decided to not even use his interview. He couldn't get his head round, he couldn't engage with the fact that the running of the NHS has now been devolved to a quango, essentially a privatization board called NHS England, headed up by a guy called Simon Stevens, who was chief executive for United Health, America's biggest private insurer. He was head of global expansion for an insurance company. Now, we were trying to tell John Ashworth, look, there's no point trying to hold Jeremy Hunt to account or Matt Hancock. The power has shifted to this insurance man. Should you not be spending time raising public's awareness that the insurance industry is running the NHS? That awareness might alert people to demand a reversal. But I detected a distinct policy of dampening down public awareness. And I'm also aware of an active process of infiltration and subjugation of campaign groups. There was an interesting article published a week or so ago in the Canary, which looked at Socialist Health Association, which has been well established for decades, but there has been a leadership struggle, and now it seems to me that the way the report read was that the control has shifted back to neoliberal Blairite Labour Party members. So not only was there a struggle within Labour to reverse the privatization headed up by Jeremy Corbyn, but there's a similar battle in grassroots organizations and other organizations like the Social Health Association. So there is a battle not only against this government, there's a battle against the media who are keeping quiet about this, but the opposition have been pathetic. Given the amount of ammunition that the Boris Johnson government has provided them, they have failed to land a punch, I'm afraid.
I mean, the National Health Service, of course, is the Labour Party's greatest achievement. And I mean, I've got a poster up in my office that said the NHS, Labour created the NHS, so the Tories voted against it at the time. But when New Labour left office in 2010, satisfaction with the National Health Service had never been higher. It was very, very high. Whether it had never been high, I think the statistics suggested it had never been higher, and there was a big reduction in waiting lists and so on. And I remember the mantra, both in terms of healthcare and indeed local government, public services, really across the piece, really was that what matters is what works. You know, it's kind of ideology was dead, although it was a kind of different type of ideology. Ideology wasn't really dead. But I mean, this notion of patient choice was something that was pushed very heavily by successive secretaries of state under the new Labour government. And obviously, as I say, there was a massive reduction in waiting times, and prided itself, that government, on I think treating cancer patients within a couple of weeks. Nobody should wait longer than 16 weeks. We saw new hospitals springing up all over the country as well, albeit built through the PFI, private finance initiative. What would your response be to those, in that government who might be quite proud of their achievements, saying, look at all the hospitals we built, Bob, look at the reductions in waiting times, this patient choice mantra that we were pushing, where we brought in the National Health Service to help, brought in the private healthcare system to help us, reduce waiting times and so on. It works. I mean, how would you respond to that?
I would say, these very persuasive arguments have been carefully thought out and crafted. In terms of building new hospitals, well, that sounds great, doesn't it? But in fact, the PFI hospital building program was extremely expensive, and each hospital they built, they ended up reducing the hospital capacity by up to a third. So every new hospital resulted in significant loss of beds. In terms of bringing the private sector in to help reduce waiting lists, well, they weren't interested in dealing with the complex patients. They wanted the easy, profitable stuff. And, we interviewed Frank Dobson, who unfortunately has since passed away, but he was quite frank. He was against this outsourcing of clinical care. It was a fundamental breach of the founding principles of the NHS that the public should provide. And the reason for that is the private sector were getting paid more than the NHS for doing the same work, and they were avoiding the complex care. So a term for it is cherry picking or cream skimming. They were doing all the easy stuff, and by doing so, destabilizing the finances of the NHS hospitals, removing training opportunities from up-and-coming doctors and surgeons. So it cast a very long shadow, and this was just the thin edge of the wedge, because it was always presented by Alan Milburn as a temporary measure. But we know ever since
State for Health, Alan Milburn.
Yeah, well, he's got significant links to the private sector, of course. Now he's doing very well helping out private health industry, but it was never a temporary measure. A bit like we see tuition fees in higher education or academization of schools. They breach a principle. often it's the Labour Party that's used to breach the principle, but the trajectory is the same. It's like a tag team.
Yeah.
You know, the Labour Party has been destroying public services with socialist jargon, and the Tories come and do it, and they don't bother with the jargon. It's
No.
the same team. They're on the same team.
I mean, in many ways, Bob, what you're saying is why I was one of the co-sponsors of the NHS reinstatement bill, which, as I've said, they've never sort of got anywhere. I mean, there was some hope that we may have made some progress in that direction had we secured a Corbyn-led Labour government. But just to kind of push you a little bit on this, I mean, just going back to that mantra that they used to talk about, what matters is what works. I guess some of them would probably say, well, what does it matter if it's in the public sector or the private sector, so long as the front end, the patients are actually getting the care, so long as we are reducing the waiting times. What is the fundamental problem with that approach, in your opinion?
What ends up happening if you remove all the easy work out of the NHS? You have the NHS subsidizing the profits of these private companies. So this is money being leached out of the system. So it's a completely bogus argument. There is no privatized health system in the world that provides universal healthcare. And if you want to provide universal healthcare, which is giving a comprehensive range of services, the only way to do that and achieve good outcomes is through a publicly funded and publicly provided system. So if you compare to America, which is the model that we are following, they spend more than twice we do per head. They have worse outcomes in terms of maternal mortality and infant mortality and lower life expectancy. So whoever's spinning these lines about just look at the outcomes, well, they're looking at the wrong outcomes. They're looking at crude figures about waiting lists. But the other trick they did was allow these waiting lists to preventably go up in the first place and then present the private sector help as a solution. This is a con. It's like me starving a child and then presenting him with a slap up meal. Well, why starve them in the first place? They cause a problem for which they have a predetermined solution.
I mean, I think my obviously I'm kind of ideologically wedded to a kind of publicly provided system. I'm playing devil's advocate here because I think it's important that we tease out the arguments to these questions. But of course, as I say, they were of a view that approach, in terms of the front end, it really made a difference. But the thing that, in terms of reducing waiting times and all the rest of it, the thing that troubled me in a way, and you've sort of touched on it there, Bob, was the fact that it was another way of using a public service, a health service in this case, of generating finance for the private sector. It's kind of using the public services or the National Health Service as a cash cow, and not a particularly efficient use of public finances. And it's rather ironic because you'll often hear politicians on the right talking about how they're very concerned about the public purse and so on, and getting value for money. When they talk about taxpayers' money, that's a misnomer. I don't want to get into modern monetary theory this evening, but they make these arguments, and yet they're more than happy. I mean, the National Health Service and what's been done there is just one example, but you look across the piece in terms of public services over the last 40 years, and regrettably continued under the new Labour government, about how those public services that have been generated, huge profits. And of course, thinking back, I remember when my late wife was diagnosed with a terminal illness, scleroderma, and she was referred to a specialist in the Royal Free in London, great hospital with a great reputation. But and this is the early 2000s, I remember when we got to the hospital and she was admitted for a couple of weeks to go through some various tests and so on. I just remember how filthy it was, Bob. It was honestly disgustingly dirty. There was a film of dust all over the lift doors, for example, under the hospital tray, the trays that go over the beds. Lonnie's saying how there was ground in sort of food debris, and then one of the get well cards that she received from friends fell behind the bedside cabinet, and she went to retrieve it, and it was just as if it never been cleaned in months. And I know that you've talked about this and the potential kind of correlation between compulsory competitive tendering of cleaning services and the catering services, and the rise in MRSA. I mean, is there a cause and link, do you think, in that regard? It would seem so, looking at my anecdotal evidence of what I saw.
No, there are papers published showing exactly that, and showing that MRSA rates, for example, were higher in hospitals which had outsourced their cleaning. And when these services were brought back in-house, the MRSA rates declined. In fact, MRSA wasn't really a problem in British hospitals until the outsourcing of ancillary services began. But, you know, the private sector is not some magical solution. How do they make money? They pick the easiest, most profitable work. They screw down the workers' terms and conditions, and they cut corners wherever possible. And the other big income stream is fraud. So we know companies like Serco and G4S have been fined for fraud. G4S was in charge of out of hours services down in, it might have been Serco actually, down in Cornwall, and they were caught systematically defrauding and overclaiming. One of those companies was claiming for tags on prisoners who had passed away, or claiming twice. So fraud is a part of the business model of the private health companies. They cannot make money without cutting corners or avoiding the sick. And in America, that's how they work. So even if you have insurance may make some people feel comfortable and protected. But if you're insured and you've got a straightforward problem, fine, they'll pay up. But if you develop a serious problem like a cancer or an expensive condition to treat, that's the point they look at your medical records with a magnifying glass to look for reasons to exclude you from cover. Now, that's not the time you want to discover you don't have insurance.
No, indeed.
So the NHS not only was a very forward-thinking thing to do, but it turned out to be the most cost-effective way to run a health service. And it was liberating to the population, removing that fear. It also had a huge economic benefit. So you're restoring people to be productive members of society, be that grandparents looking after grandchildren, or people returning to work, or, you know, being pain-free. There's a huge economic benefit from having a healthy population, and it's a system that was copied across the world. But unfortunately, the prevailing ethos is to change the beverage style systems into those along the American lines. And in terms of, you mentioned a couple of names there about being rewarded for failure. Well, the current chief executive of NHS England, Simon Stevens, he worked in the NHS under Blair and headed up the most expensive IT public sector white elephant in the history of IT.
Yeah.
He squandered £12 billion in a fiasco called Connecting for Health.
Isn't that though, Bob? You know, I remember that very well. I served on the local primary care trust, and it seemed to me that that was then used as, I mean, I'm not saying that necessarily was the motivation for it, but it seemed to me that that was then used by, you know, opponents of public services to demonstrate that how inefficient the public sector actually is. You know, look at the public sector spending all this money. They can't even get a kind of computer system right. Sounds very great. I mean, it did actually sound wonderful, actually, but it didn't work, as we know. But that, I think that was then used as a stick to beat it with, wasn't it?
Well, exactly. And then playing the same trick with supposedly NHS test and trace.
Yeah.
So the failures of Serco and Deloitte are contaminating the reputation of the NHS. And that's a constant trick. So the BBC are renowned for never separating out where is the failure. Is the failure of the outsourced company, or is the failure of the public provision? But I'm not deluded. The NHS now is struggling. Yeah. The NHS, my patients are regularly let down by the NHS, and that's because money has been squandered elsewhere and the NHS has been undermined. So, you know, I cannot safely say to my patients, there's one hospital in particular in Southeast London I warn my patients not to go to, because the record of how they've dealt with patients of mine is appalling. But I know how they ended up there. It's not because of the model of the NHS. It's because what consecutive governments had done to that model.
Yeah, but look, I mean, this is obviously a global pandemic, and every country's is wrestling with this problem. And I mean, how are we comparing in your experience with other European countries and indeed countries from elsewhere around the world? I mean, we're here in the United States; it's a bit of a disaster, but I mean, how does Britain compare in terms of the COVID-19 crisis in particular? I'm thinking of.
So just relating to the pandemic, the two parameters that are important are the number of deaths occurring per head of population. And the last time I checked, the US and the UK were the worst performing, had the highest death rates, either directly due to COVID or what they call excess mortality, which is looking at the average death rates for a period of time in the last 5 years and looking at the current death rate. And the current excess death rate in the UK is in excess of 75,000. In the US, numbers are approaching 250,000. And what you see is the countries that have the most privatized and fragmented systems are doing the worst. But where you had a strong government which took pandemic preparation and empowered local clinicians to do the right thing and imposed timely, early, strict measures, they have done extremely well. So Wuhan, for example, the BBC were quite happy to cover it and with a smirk on their face, criticizing how draconian it all was. They had very few deaths, and within a few weeks they were opening up the economy and returning to normal. In fact, they had their system running so smoothly that when there was a sign of a little outbreak, they, in a 2-week period, screened 11 million people.
Amazing.
In 2 weeks.
Hospital as well, was it 6 days or something? I mean,
yeah, they put up a hospital in a short period of time. So that's how you do it. But here we, first of all, we dismissed the threat. Then we delayed locking down. We never closed the airports. We had 18 million people bringing the virus in. We allowed, even when we did have a lockdown, it was not a proper lockdown. If you were on a construction site, well, somehow we couldn't delay the construction of a luxury block of flats. That couldn't be delayed. So those were going back to work on crowded London Underground and buses, which had reduced services to make the chance of spread even worse. Sure. You couldn't make it up. But the people who have paid the heaviest price are the people who suffered from the 10 years of austerity, the people who have precarious work, the people who are public facing, the so-called essential workers who have been treated like dirt, in at least over the last 10 years. Yeah. So you have desperate people who cannot self-isolate, who can't afford to self-isolate, who put themselves at high risk, whereas the commentariat go to their second houses in Spain and ring up TV stations telling them how the workers need to get back to work. Yeah. The hypocrisy is staggering.
Absolutely. I mean, it's interesting that I was pleased to say that there'd been some corporate media, mainstream media coverage, a kind of a recognition, not as much really as I think there should be, about the class dimension, which you've touched on there, Bob, to the COVID crisis and how it's, working class communities, the key workers that you mentioned and so on, and finding it more difficult to isolate for a start, but then also because of the nature of their work and so on and so forth, being more exposed to it. And frankly, in my opinion, I know I want to talk a little bit about your thoughts about the way the corporate media has covered this whole issue, really. But I mean, that's an area where, I mean, there's been a bit of attention, but I mean, in my opinion, nowhere near enough. But what's your thoughts in general, Bob, about the way the media has, the mainstream media or the corporate media, whichever way you want to refer to it, how do you feel they've covered this issue, both in terms of the international dimension, comparing Britain to other countries? You've talked a little bit about how they rather sneeringly referred to the Chinese response. But I mean, how do you think? I mean, are they covering themselves in glory? Essentially, the media, are they doing their job properly in terms of reporting this accurately or not?
No, they're not, because they are part of the problem. They have to perpetuate the myth that somehow the NHS is not being privatized. Early on, they were comparing us to other countries, but as it became more clear that we were one of the worst performing, they stopped comparing us to other countries. I don't know if you've noticed, I haven't heard a comparison on the BBC for weeks, if not months. So they're no longer comparing us to anywhere else who's doing a lot better. When there are press conferences, they let whoever's speaking on behalf of the government off very lightly. They're certainly not pushing on the crony contracts that are being handed out left, right, and center, spending billions without much scrutiny and without public oversight. So the interrogation they're giving to the politicians is minimal. The comparisons have gone. But what is also going on is there's always a psychological element to how the news is presented. Now, we have become conditioned to no longer be alarmed by hundreds of people being announced as having died within the last 24 hours. Now, when the coronavirus struck, when the numbers were in the 10s and the 20s, it was alarming. Now, today we hear 500 people have died. It's no longer alarming. We have been, I think, quite deliberately desensitized to the unfolding tragedy in order to dampen down our reaction. So it's like a shrug of the shoulders. Also, the media went along with reporting the statistics in the least harmful way to government. There was a conscious effort at the height of the first wave to make sure that the numbers didn't breach the psychological barrier of 1,000 deaths per day. So what they started to do was separate out the figures and not include the nursing homes entirely, or to delay announcements. So there was statistical manipulation going on. And again, the mainstream media were just quite happy to regurgitate what they were told at the press conferences. So
how many invitations have you had, Bob? Because I mean, you're probably one of the best known NHS campaigners. You filmed the NHS Great NHS Heist, for example. How many times have you been invited to? I mean, you're an expert. I mean, you're a practicing GP. You know, you know your stuff. You've kind of researched it. You've done the film, etc. You kind of would be, I would have thought, an ideal guest. I mean, do you get many invites to appear on broadcast media?
Well, I got quite involved in 2016 with the junior doctors dispute. And so that's where I made a lot of links with other doctors and hospital colleagues. And people who were like-minded were reporting back how there was a screening and a censoring going on. So some of my colleagues were interviewed by BBC on the radio and on TV. Now, if you were interviewed live, you could get away with saying something. But if it was pre-recorded, you'd be edited out. And if you did say something they didn't like, you would never be invited again. Now, I'll give you one example of my personal experience, two examples. I was invited onto the Victoria Derbyshire show, and they were talking about how the junior doctor contract would cast a very long shadow, put people off staying in the NHS, lead to a workforce crisis, and have a knock-on effect on patient safety. Now, I made the case that it's essential, if you're going to hand everything over to the private sector, you've got to reduce their number one overhead, which is the wage bill. And by trashing the protections of the junior doctor's contract, you enable them to be cheaper to employ, and also to be employed across the NHS and into the private sector. Now, my contribution got a significant round of applause. A decent journalist would have followed that up. Why do you say that? What makes you? But it was shut down. And other people, for example, Dr. Sarah Ganguly, who I met for the first time at that studio interview, they were pre-screening people. So they'd go around with a mic and say, what are you going to say? Her mistake was she said, I want to mention privatization. So they never went to her. I said, I want to talk about the junior doctors working in my surgery. I didn't tell them I wanted to link it to privatization, so I got on. So there is a censorship of certain views. You can only go so far, and if you go too far, you won't get invited on again.
So you're not a go-to talking head then, by the sounds of things, and you're not getting on a regular basis, not in spite of your expertise in the field.
Not at all. I got onto the BBC because I volunteered myself to be part of a group. I was invited as a guest onto the ITV politics show. I forget the name. It's the equivalent of Question Time. I was one of 6 invited guests. This was again during the junior doctors dispute. And they went to each guest in turn, asked for a comment. I was the only guest who was edited out.
Good Lord.
and
Yeah.
I had 1 minute to make a contribution.
Yeah.
Whereas they filled the program with lots of other relatively weak points and
Yeah.
unevidenced points. So I wrote to the producer. I said, "What happened there? What how comes I was the one of 6 people? I was the only one edited out." They said,
Yeah.
"Oh, it was time. It was nothing," and they offered to send me a box of chocolates and a bunch of flowers.
Yeah, that's going to go a long way. Yeah. To,
And I said something along the lines of, "You know where to stick those."
yeah. No,
So
indeed. Indeed.
it's a stitch up, I'm afraid, and. Whereas other broadcasters like RT
Yes.
are happy to have me on and allow me to say what I need to say, completely uncensored.
No, I've seen
Whereas,
you on, I think, with Afshin Ratanzi on the groundbreaking Going Underground, which is a seminal program. People should watch it. And yes, I've seen you on there, Bob. And obviously they do attack the corporate media and the Tories and indeed the Labour members in Parliament attack RT and say it's just Kremlin propaganda. I mean, how would you respond to that?
well, I wouldn't go to them as the first point of call if it concerned Russian internal affairs. But in terms of reporting how bad the UK is, you're going to get a much more balanced and honest opinion than you're going to get from the BBC. So you have to be selective about what sort of information and where you want to get it from. But if you watched just the BBC and believed everything that they were telling us, well, we'd still be looking for weapons of mass destruction in Iraq.
Yeah. It's a great sadness to me. I mean, I grew up, born in the 50s and grew up in the 60s. And I remember, and in the early 70s as well, to be fair. I mean, people like, John Pilger, and there were some really excellent current affairs programs that did actually, on the mainstream media, that did actually probe and really hold power to account. I mean, I didn't necessarily always agree with. I didn't necessarily understand it fully as a youngster, anyway. But just sort of thinking back, they seem to be much better at doing their job than they are in this day and age, which is a real regret. However, we do have, which we didn't have then, the advent of new media, social media, and we've got this program that we're on this evening. And I think it's important, therefore, that we try and spread these voices as much as we possibly can, so that these views, which are very, very important, are actually given an airing, and hopefully we've made some contribution to that tonight. I just want to go on, though, Bob, if I may, to talk in this a little bit now. There was this announcement, was it yesterday or was it today? I can't remember. But anyway, great sort of fanfare that a vaccine has been discovered or on the verge of actually providing this vaccine. What's your thoughts about that? And there has been sort of debate about, or should it be compulsory or not? I mean, are you hopeful about this vaccine? What would your advice be to people as to whether, when it does become available, as to whether or not they should, assuming it's not compulsory? I don't think, well, hopefully it won't be. But I mean, in terms of it coming on stream, what would be your advice to your patients and indeed to people watching this evening?
It's welcome news. Nobody could argue that if you have a effective vaccine which will protect you from the infection, why not take it? The problem is it seems to have been rushed to get to this point. The information we're getting is from the drug company. The drug company have a huge vested interest in overhyping and overclaiming the benefits of the vaccine. So I would like to see some more independent sources which can tell us how good and how safe the vaccine is. If you look at the past history of drug companies, they've been involved in major scandals where they suppress negative results and exaggerate positive results. We know that in a previous pandemic, Gordon Brown stockpiled Tamiflu, which was a drug supposedly to ameliorate the previous SARS virus. The reality was that the studies that showed it had lots of side effects and was no better than taking paracetamol were suppressed. So we have to look at this announcement with caution. It's a step in the right direction. There are multiple vaccines being developed: China, Russia, I think Cuba, and Pfizer, which is a big American company. But we need to tread carefully, not accept everything on face value. I don't think we should exempt these companies from lawsuits should they prove to be a big problem in the future, which I think America have done. So I'm all for immunization, but it has to be shown to be effective.
Are you? I mean, it's speculation now, I accept, but I mean, are you hopeful that that a safe vaccine, or as safe as they can be, will be available before the end of this year or before the spring, or do you think it's going to take a bit longer? Or is it just too difficult to say on that?
It's difficult to say, but from my understanding, not all viruses are the same, and not all viruses are amenable to a vaccine. The way the immune system is triggered off by a vaccine varies from condition to condition. What we need to know, and we don't know yet, is when they say 90% effective, what do they mean effective? Do they mean there's an antibody response you can measure in the lab? Do they mean it actually protects you against the infection? How long does that protection last? Is it equally effective in every age group? We don't know any of this, and neither do the media ask any of this information. So on face value, it's welcome, but I would suggest don't get overly excited. Don't ignore the simple measures that we should have been doing from February. And what is more important is to fix the current testing, tracing, isolation, and support system. That is the bedrock of managing a pandemic, not wishful thinking about a vaccine.
Yeah. And what's your thoughts, Bob, as well? I mean, there's as you, I'm sure, have seen quite a movement about this pandemic and the seriousness of it, and campaign to suggest that we shouldn't be wearing masks. Would you have any advice for viewers about that? Because I mean, that's got a bit of traction. There's been protests, as we've seen in the Northwest, in London and so on, and people sort of saying we're not going to wear masks and so on, take your mask off. Is that dangerous advice?
I think we should all be trying to minimize not only risk to ourselves but to others. Now, if you have the virus and you're actively symptomatic, you're going to be carrying a lot of virus particles in your throat and your chest. So if you cough in the vicinity of people who don't have the virus, you're putting them at high risk. So it's nonsensical to say, let's not take these extra precautions. Washing your hands, avoiding touching your face, all makes good sense. And I've having to wear a mask since we knew about this back in February for all of my patients. Yeah. And touch wood, I've been okay because I've been following these simple measures and ensuring good ventilation. Yeah. But if you dig a bit deeper, the misinformation and concern around what the government's doing, some of it is deserved because they've handled this appallingly. Yeah, they have destroyed the public trust themselves with how Dominic Cummings behaved and how he didn't follow the rules himself, how Boris Johnson himself went around telling everybody there's nothing to worry about, take it on the chin, and how he shook everybody's hands in the hospital ward. So they themselves have sown the roots of the growing disbelief, and people are fed up. Who wants to wear a mask? But the reality is it's a relatively minor intrusion, and it may well save lives. So what's to lose,
Oh, indeed. I mean, and they I absolutely agree. I mean, they really have contributed to the levels of confusion, and really do have a lot to answer for. And just going back to the point about the way the media have reported this whole thing, they really, I don't think, have scrutinized and held the Prime Minister, for a start, to account for the irresponsible way in which, in my opinion, that he's conducted himself. And it's my partner works in the National Health Service, and in her department, a couple of doctors have died. I mean, they contracted COVID and sadly have lost their lives. So this is a real thing, and I think there's real problems, obviously, the way the government's conducted itself. But just from your perspective, what you're saying there, Bob, is I guess even if you're skeptical, I mean, why take the risk, and why put other people at risk? I mean, if you're a decent citizen, I mean, I think, in my opinion anyway, people ought to wear the mask, notwithstanding whether they are skeptical or otherwise, just to be on the side, really.
Yeah, but if you I read something, I think it was in Byline Times, that some of the funding that's going to back up these conspiracy theories and sow seeds of division within society, some of that comes from these right-wing think tanks, which have been very successful in America. So they are not the general public's friends. They like division, they like chaos, and they are not a voice that we should be listening to. but the government has been, significantly at fault for certainly where we are now. Had they not squandered the lockdown time, had they set up and invested in the public service, had they not completely sidelined GPs in the response to the pandemic, had they spent money wisely, we would not need a second lockdown. We would be opening up the economy, we'd be living life close to normal, as they have done in countries like New Zealand, in China, in Singapore, in Japan. What is our problem that we can't even look abroad and copy what they've done so successfully at a fraction of the cost?
Yeah, no, it's a good advice, Bob. Just before I bring in Sean to get audience reaction to our fascinating discussion this evening, there's one other final point I just wanted to put to you, and it relates to the pharmaceutical industry. And as you mentioned, Pfizer have apparently discovered a vaccine. One of the things I was a little bit curious about really is why back in the day when the National Health Service was founded, and indeed subsequently, Labour governments, proper Labour governments, rather than the new Labour aberration, why they didn't actually nationalise the pharmaceutical industry. I mean, speaking as a layperson, I would have thought that would have cut out the kind of waste and so on, and obviously the kind of the profit motive. I mean, I guess the proponents of the kind of private role, as it were, the private sector role in that is that this sort of entrepreneurial spirit. It actually promotes sort of the groundbreaking technologies, because obviously they're looking for that profit, and without that incentive, it would be less efficient, and less good drugs and cures for conditions would be found. I mean, what do you think about that? I mean, that's been my position for a long time about we ought to be pressing for a campaign to nationalise the pharmaceutical industry, but that's always been kind of poo-pooed, even by people on the left. Actually, I've found people on the soft left have sort of never bought into that.
Yeah, I think these claims that the private sector is the engine for innovation. Well, if you look at where did the innovation occur, most of the time it occurred in public universities. If you look at the internet, that was as a result of the United States Defense Department, work done by NASA, work done by MIT. 99% of the technology in the iPhone comes from publicly funded universities and institutions. So their skill comes in marketing, advertising, and charging the most they can get away with, and paying the workers as least as possible. Yeah, that's where their innovation comes from. So there's a strong argument, certainly, for a nationalized generic drug industry. What the private companies do, they don't want to compete. They want monopoly. They want to destroy competition wherever possible, and they want to extend patents. So that means they want to gouge the patient for as much profit for as long as possible. And they buy up competitors and no longer produce a competitor drug. So they have monopoly position. This is profiteering at the cost of human life. And there is this very, very strong argument for nationalizing the pharmaceutical industry. Yes.
Good. Well, I'm pleased you're a fellow traveller with me on that one, Bob, and we need to probably ratchet up that campaign, because I don't think there's been enough, in my opinion, made of the need for, in my opinion, a nationalised, a publicly run pharmaceutical industry, or indeed the waste that you very eloquently identified there. So there's so many campaigns we need to do, Bob. I suppose there's only so many out of the day, but I do think that's a kind of an important one. But anyway, let's see what our viewers think. If we can hand over now to Sean, and she's been sort of monitoring what people have been saying, and we'll put any questions that people might have in the last 10 minutes. So over to you, Sean.
Hi, thanks for that, Chris. Oh my goodness, the debate has been going mad on YouTube tonight. We've got well over 50 people on there, and they all think that our Dr. Bob is a hero. So you're getting lots and lots of positive comments and thanks from people out there, Bob, tonight. So just to go through some of the comments, there's been absolutely loads of comments and questions coming in. Anne Newton Marcial What now since Biden got in? Will we lose the NHS trade deal? Can we start with that one, Bob? Because I think that's a big one on people's lips.
Sure. So I think it may slow down what the Johnson government had intended, but we should not mistake that every president of the United States is interested in the interests of their corporations. Now, if by doing a trade deal, they can lock in access to public service budgets, be that education, be that health, be that social services, that's what they want to do. And even under Obama, when Biden was his vice president, there was a pressure for TTIP, which is another trade deal, which also wanted to include the NHS. So I'm afraid just a change of figurehead does not remove the threat the NHS might face in a trade deal.
Okay, thank you. Kevin Rathbone, he says, do we need to revisit corporate manslaughter and culpability laws over the coronavirus fiasco?
So I've been tweeting about this for some time. If I, as a doctor, time and time again made decisions which cost the lives of my patients, quite rightly I should be facing regulatory sanction and maybe prison time. But if you're a politician and you're in government, you're protected by something called Crown indemnity. So if you make a decision while in that position, you face no prospect of being criminally liable. Now, to me, this is how we've entered into one tragedy, one disastrous public policy after the other. For example, deregulating fire safety on buildings that led to Grenfell. The push to deregulate, the push to reduce monitoring, the push to shrink the state is costing lives. And no politician would dare do that if they faced the prospect of the police feeling their collar.
On that point you made as well, Bob, if I could just dip in quickly there in regards to deregulation of fire safety, that was done under a new Labour government as well. So it's not always the Tories. I mean, obviously they've done a lot of damage, but it was continued and indeed made worse in some circumstances by that Labour government, which should be to the party's eternal shame. Anyway, sorry. Go on, Sean.
Okay, so we have another question from Candy Gregory. How do Chris and Bob feel about Keir Starmer's failure to take a lead in the polls when the UK has EU's worst COVID-19 death rates and NHS colleagues are on their knees?
What's your thoughts, Bob?
What I've seen of Keir Starmer and what I know of his previous actions when he was Director of Public Prosecutions, how he contributed to the political imprisonment of Julian Assange, how he hired a private healthcare lobbyist to be an advisor, it does not surprise me in the slightest. What I see in Parliament at the moment is a Punch and Judy show with no genuine intention to hold the government to account. So we have theatre, we don't have real politics. We have two parties now who don't really disagree on very much, but choose to entertain the public with this fake opposition.
Yeah, I mean, I think the question was put to both of us, and I would concur with Bob's views there. I think the problem is that the parties are far too close now. There is no real alternative, and many of the popular ideas that were being promoted by Jeremy Corbyn are being sort of steadily abandoned. And of course, it's important to remember as well that Keir Starmer was the architect of the Labour Party's defeat at 2019 with his insistence on adopting a commitment to a second referendum, which destroyed Labour's chances, in my opinion, when you just turn your back on massive democratic mandate such as there was. And in my opinion, what we should have been doing, what the opposition should have been arguing for, is a people's Brexit rather than a banker's Brexit. We should have been saying, I say we, the Labour Party should have been saying in that election that we will get Brexit done, just as well as the Tories are saying they will get Brexit done. The difference is we'll deliver a Brexit that works in the interests of the 99%. They're going to deliver a Brexit which works in the interests of the corporate elites. Quite faceless corporate capitalism. That's who's going to benefit from a Tory Brexit. But, sadly, we are where we are. And I think that is the reason, in my opinion, why the Labour Party hasn't stormed ahead. Plus the fact, of course, that they're spending a lot of their time trying to find bogus reasons to kick people out of the party, including the former leader, obviously Jeremy Corbyn. I mean, it's not exactly a great way to bring the people together, bring the party together, and put forward a coherent plan which is going to be attractive to the public.
I must say the timing of Jeremy Corbyn's suspension was a great assistance to divert attention from us entering into the second lockdown because of government gross failure to manage the pandemic.
Of course, absolutely.
Just moving on and talking about the corporatocracy. Oh, I can't say the word. You know what I mean? The monopoly of the corporate businesses. Shani Jones asks, why is no one ever corrected in Parliament or in the mainstream media when they refer to the NHS test and trace when it is not NHS but Serco?
Well, it's going back to the media, doesn't it, Bob? But go on.
I couldn't agree more. It's Serco Test and Trace, and it's Serco subcontracted to 20 to 30 other companies, Test and Trace. And the person in charge of the Test and Trace has no experience of public health, is a failed CEO of a mobile phone company, and has links to, is married to a Tory MP who happens to be the czar for corruption in government. So, you know, we don't only have a coronavirus, we also have a crony virus.
Yes. Very well put. Yeah. And finally, from Dickie Hands, how many excess deaths are as a result of people with pre-existing conditions not having access to the NHS due to COVID?
I don't have the exact breakdown, but at the moment we're approaching 50,000 deaths who are COVID positive. The last figures I saw for excess deaths are in the region of 75,000. So that would make around 25,000 who were not directly related to COVID. I know from personal experience that people who were with the first lockdown, who were severely ill, who needed medical attention, didn't go to hospital, delayed going to hospital, suffered as a result, because they were told no longer was the NHS there to protect you, you had to protect the NHS. How perverse can you get?
Yeah, absolutely.
Yeah, definitely. Well, I just want to thank everybody on the chat tonight. It's been brilliant. And Bob, I think we need to get you back more regularly because this has been, it's been fantastic. People have been absolutely fascinated and they think you're wonderful. Thanks,
Great.
Chris. And good night to everybody else.
Yeah, thanks very much indeed, Sean, and thank you, Bob, and thank everybody for tuning in. I really appreciate that. And just in terms of Bob bringing you back as a regular guest, we are hoping to, at some point in the fullness of time, expand the Resistance TV output. And hopefully then, if we are able to be on more than just simply once a week, we if you're free, we might be able to have you back for a more regular slot. I think it would be valued by a lot of people, actually, and a great alternative to the lack of kind of any proper scrutiny that we're seeing about what the government's doing in relation to the National Health Service. So thank you again, everybody, for watching. We are now out of time. Please tune in next week, though. We've got a really excellent show next week lined up. We're going to be discussing 21st century socialism, and we've got three brilliant guests. Tommy Sheridan, who many people will be familiar with. He's a well-known activist from Scotland who was a former member of the Scottish Parliament. And he is a commentator now in the alternative media, it has to be said, but he will have, I'm sure, a lot to say about the development of 21st century socialism. Our second guest will be Kerry-Ann Mendoza, who is the editor-at-large for The Canary. And our third guest will be Ben Norton, who is the assistant editor of The Grey Zone, another excellent alternative news output station that's based over in the States, but they cover a lot of international affairs. So if you're available, make sure you carve out an hour at 7 o'clock next Wednesday and tune into Resistance TV and watch the discussion on 21st century socialism. That's it for this evening. Thank you for watching and good night.